Hi, my name is Essence Fife, and today for my informative speech, I will be talking to you about sickle cell disease. For the past 18 years, my daughter has been in and out of hospitals. She has had symptoms ranging from fever to acute chest to pneumonia. She has had blood transfusions for many years, only stopping due to iron overload. She takes 10 different medications daily, and in her last year of high school, she has been placed on homebound due to chronic pain. My daughter suffers from a disease called sickle cell anemia. This disease has taken a toll on my daughter's life, and I just wanted to speak about it because not many people know about it or the effect it has on those who suffer from it. Sickle cell is a very painful disease. The trait is passed from the parents to the child. I have the trait, and her father has the disease, which is how she came to have this disease. Many strides have been made in finding ways to cure sickle cell anemia, so there is hope. Let me begin by telling you about sickle cell anemia, its origins, symptoms, types, and treatments. Sickle cell disease is an inherited form of anemia where red blood cells become abnormally long and pointed, similar to a banana. It affects approximately 100,000 people in the United States and millions worldwide. In the US, it occurs in about 1 out of every 365 African American births and more rarely in Hispanic American births. Although sickle cell disease is not an extremely rare condition, there are some lesser known facts and misconceptions everyone should know. Although sickle cell disease has been long associated with people of African descent, it can be found in many races and ethnic groups, including Spanish, Brazilian, Indian, and even Caucasian, which is why all babies born in the United States are tested for this condition. Sickle cell disease is not contagious like a cold. People are either born with it or they are not. People with sickle cell trait cannot develop sickle cell disease. In the United States, every baby is tested for sickle cell disease. Identifying children with sickle cell disease in infancy can prevent serious complications. There are different types of sickle cell disease which vary in severity. Hemoglobin SS, which is what my daughter has, is also the most common type, and sickle beta 0 are the most severe, followed by hemoglobin SC and sickle beta plus thalassemia. There is a lot more to sickle cell disease than just a painful crisis. Sickle cell disease is a disorder of the red blood cells, which supplies oxygen to all of the organs. Because sickle cell disease occurs in the blood, every organ in the body can be affected. Patients with sickle cell disease are at risk for stroke, eye disease, gallstones, serious bacterial infections, and anemia, just to name a few. Although all people with sickle cell disease are at risk for stroke, children with the disease have a much higher risk. And because of this risk, the physicians who treat children with sickle cell disease use an ultrasound of the brain to screen and determine who is at the highest risk and start treatments to prevent this complication. The antibiotic penicillin is life-saving. People with sickle cell disease are at increased risk of bacterial infections. Starting penicillin twice a day for the first 5 years of life has changed the course of this condition from something only seen in children into a condition people live into adulthood with. There is more than pain medication for treating sickle cell disease. Today, blood transfusions and a medicine called hydroxyurea, which my daughter takes daily, are changing the lives of people with sickle cell. These therapies are allowing people with sickle cell disease to live longer lives with fewer complications. Multiple research studies are ongoing to find additional treatment options. Bone marrow, also called stem cell transplantation, is the only cure. The best success has come from donors who are siblings whose genetic makeup matches the person with sickle cell disease. My son is a match for my daughter, and so we are trying to get the transplant done in the summer. Sometimes types of donors, like unrelated relatives, parents, are used mostly in clinical research studies. In the coming years, gene therapy looks like a promising treatment. I hope this helps to give you a little more insight into sickle cell disease and maybe raise your awareness a bit. Thank you.